Hello and welcome to Inspire Her. My name is Tina Cosby and I am the host of Radio 1 Indy's talk show Community Connection every day on AM 1310, 92.7 FM and 95.1 FM The Light. The name of this seminar is Changing Lives Through a New Career in Nursing and is sponsored by the Marion University Accelerated Nursing Program. We have a distinguished and knowledgeable panel lined up for you, so let's meet them right now. Our first panelist is Kierra Adams. She is an ABSN graduate as of December of 2020. As a Marion University nursing student, she's been able to work as a peer tutor. She is currently working as an RN at Vanderbilt University in Nashville, Tennessee. Welcome, Kierra.
Good morning.
Good morning. We also have with us Audrianna de Leon, an ABSN graduate as of May 2020. Adrian is a graduate of Marion University ABSN program in May of 2020. She began her nursing career at IU Methodist on a multi-specialty surgical care floor, but she is currently in orientation for labor and delivery at Ascension St. Vincent Women's Hospital. She is also pursuing her MSN in education. Welcome, Audrianna. Glad to have you with us today.
Hi, Tina. Thank you for having me.
Thank you. Also on the panel today, Dr. Tamaria Cox. Dr. Tamaria Cox. She is the Senior Director of Nursing Services. Dr. Cox serves as a Senior Director of Senior Director of Nursing Services. Dr. Cox has practiced in adult health in the medical surgical area. She also has worked in clinical documentation, which helps with proper hospital reimbursement based upon physicians' diagnosis. Dr. Cox has an earned doctorate degree from the University of Southern Indiana. She is certified as a medical surgical registered nurse, a nurse educator, and a clinical documentation specialist. Dr. Cox has taught in both the undergraduate and graduate level nursing programs, teaching such courses as theory, ethics in nursing practice, leadership, and community health nursing. In her current role, Dr. Cox serves as the co-coordinator of the Diversity, Equity, and Inclusion Program. Through this work, Dr. Cox works with employees at all levels to help cultivate a healthy working environment. Her efforts are focused on shaping the knowledge, skills, and attitudes of others to help address and enhance diversity, equity, and inclusion-related efforts. Thank you, Dr. Cox, for joining us. Welcome.
Thank you for having me.
And we also have with us Dr. Dorothy Gomez. She is the Dean of the Leighton School of Nursing. Dr. Gomez has an extensive history of instruction in undergraduate nursing. This includes fundamentals of nursing, health assessment, pharmacology, adult health education, and counseling, research, and special topics. She has served as a data collector, capstone advisor, and adjunct instructor at Indiana University. Say that. She has also instructed many courses across the curriculum at Marion and has helped to develop a study abroad course for Marion University undergrads. Dr. Gomez has held quite a number of academic appointments, which include clinical instructor, assistant professor, associate professor, and her current roles as the Associate Dean of Graduate Programs in the Leighton School of Nursing and Acting Dean of the LSON. She holds a BSN from the University of Miami, an MSN in adult health critical care, and a PhD in nursing from Loyola University in Chicago. Her affiliations include the Emergency Nurses Association, the Hectone Institute of Medicine, and please correct me if I said that incorrectly, of nurses and Nurses in the Humanities, the National League of Nursing, and is an active member of the Honor Society of Nursing Sigma Theta Tau Omega chapter. Professionally, Dr. Gomez has experience in medical surgical units and emergency departments, including trauma centers serving both adult and pediatric populations. This diverse experience informs her facilities across the nursing curriculum. She holds a PhD in nursing research from Loyola University, as we said before, and has experience in the advancement of graduate research projects, as noted earlier. Additionally, she has a history of publications in peer-reviewed journals and nursing texts. So, as I said, right off the top, we have a very distinguished, quite an able, and quite knowledgeable panel here to handle this very important discussion. So when we talk about careers in nursing, I guess the first question that should be asked, and I'll ask this of you, Dr. Gomez, is why did you decide on a career in nursing and nursing education? And what has been your career journey, in addition to what we just said?
Yeah, well, I'm sorry that was so long.
That's okay. You know what? It helped, but it's good context. It really is. It's very good.
I chose nursing as a career back in the 70s for nursing, and became a nurse in 1979. So I've been a nurse a long time. And like many of our students, I think we start off wanting to be a nurse because we want to help people. But we find out that there's so much to learn in nursing, that the thing that I enjoy most about nursing is that you learn something new every day. I've been nursing now for many years, and every day I learn something new. Maybe it's about interventions, and in nursing education, it could be about how to deliver a better modality of education for nursing students. So for me, it's the fact that you can learn something new every day that keeps me in nursing. My journey in nursing has been a long one. I started as a diploma nurse and ended up getting my PhD in nursing at Loyola because I had worked at Marian University, which is a Catholic institution, for a long time. I wanted to experience Catholic education as a student too. So I went back to school to get my PhD degree from Loyola because it was a Catholic institution.
Okay. So, Dr. Cox, I'd like to ask you the same question that I just asked Dr. Gomez. Why did you decide on nursing, and what has been your career journey so far that you'd like to share?
Sure. So I went to North Central High School, and they had a career transition school, J. Edward Light. And within that, I obtained my CNA license and really started my journey there before I even graduated high school. Some people may say that sometimes nursing choose you, and I do feel like nursing chose me. And I really like the ability to care for others and serve others and connect with people in ways that you may not normally be able to. I actually am an alum of Marion University. I love to say that. And Dr. Gomez, back in the day when Marion was a college, she taught me the fundamentals of nursing. So my journey has been I've been very blessed and fulfilled. And through the years, I have really enjoyed the professional development side of nursing, which led me into education. And so I love just working with nursing students who will be our future colleagues. And I'm so happy to see Kierra and Audrianna and all the work that they're doing, and just seeing them blossom.
Yeah, and speaking of students, Kierra and Audrianna are closer to that source. They're closer to that space that you just talked about, Dr. Cox. So Kierra and Audrianna, I'll let Audrianna go first because her name starts with an A, and Kierra will do you next. But tell us about your interest in nursing and what drew you to the profession.
So originally my first degree is athletic training, and I was planning on going to occupational therapy school, but for me there was something missing and I couldn't quite put my finger on what that was. And so I looked into nursing, and I realized that, maybe this is something that I want to do. So I looked more into it, and my grandmother was a nurse, and I felt like it was more suited to what I wanted to do, because with nursing, there are so many career paths you can take. And I've always had a passion for learning. So I just went that route, and I ended up being one of the best decisions I've ever made.
Oh, wow.
So thus far, I worked on a multi-specialty surgical care unit, and now I'm going toward labor and delivery. My passion is women's health and education. And I'm currently pursuing my master's in education, because I feel like a lot of what's missing at the bedside on both the part of the patient and some of the nurses in general is education, cultural competency. So that's kind of where I want to focus.
Indeed. And Kierra, what's your story? Tell us about it.
Okay, so my story, I started with a degree in biology from Ball State, and I was doing that because I kind of wanted to get into lab research. I was doing microbiology lab research, but as I was entering my senior year and really getting into that research, I kind of decided, maybe this doesn't exactly fit my personality the way that I want it to. I wanted to be able to connect with people more and just get on a more intimate level with actually serving my community. So I had a cousin who was in the Marion Accelerated program at the time, and he kind of just egged me toward it. And so I checked it out. It ticked all of my boxes. So I'm very happy that I did it. And now I'm a nurse at Vanderbilt in Nashville.
So I'll ask this, and whoever wants to just take it, just go ahead and take it. But what makes for a good nurse? What makes for a good nurse?
I can start off the conversation if you'd like.
Okay, yeah, I'm just curious because nursing is so diverse and so unique. And, you know, I was just recently with a family member in the hospital not too long ago, and the nurses were phenomenal. But they were all different personalities, if you will, but I guess they all had the commonality. And so, yeah, what is it? What is it that just pulls a person into nursing?
I do think that the thing that pulls people into nursing is different for everyone. So there are people that really like a high-tech environment, and there's that availability in nursing in an ICU setting, in the hospital setting. But there's also people that really want to reach out to people in the community and change how the community is. So I think the best thing about nursing and what draws people in is that there's such a varied amount of roles that they can work in the future, and they can actually go from one role to another role as a nurse at the bedside and be a nurse in the community, a nurse wherever they want to be, because we know we have nurses in schools, we have nurses in occupational health, and we have nurses kind of everywhere. So I think the diversity is what draws people in, because they know they can change who they want to be as they go on and still be a nurse.
But there's still a lot of Florence Nightingale in each and every one of them, though. There has to be. There almost would have to be. Dr. Cox, as an educator, what student stories have stood out in your memory as inspirational, if you will?
That's a really good question. And I don't know that I have one particular story, because honestly, all of our students inspire me. Mm-hmm. So I work with the adult learners who had a bachelor's in something, and now they want to get a bachelor's in nursing. And their perseverance, their resilience, their ability to just kind of dig in, it's just very inspiring to me. Nursing school can be very rigorous, and the students that we graduate are just so remarkable, and their stories are just so telling. And I think all of them are an inspiration to all of us, and what they do and what they want to become in the nursing profession.
Yeah. Not everybody can do this, though. I mean, you got to admit, you all are a special, very unique group. Not everybody can do what you all do.
Yeah, it can be, and that's why I said earlier, sometimes they say that nursing calls you, and to the earlier points from our graduates, sometimes it may be a delayed call, or maybe they thought they were going to be a nurse and went a different route. But our career changers are very phenomenal. And the field of nursing, we have a huge shortage. So it's a really great field to be in. And there's so many opportunities for our graduates right now.
So Kierra, speaking of being a graduate, now that you are an ABSN graduate and nurse, how do you feel about your decision to take on the challenge of the program? How do you feel about it now that you're there?
Yeah, now that I'm done, of course I can be like, oh, it was so great. But no, seriously, it really was one of the best decisions I probably could have ever made. I know that I feel more solidified, and I'm more proud of myself now that I have gone through the program. Not that I have not one, but just 2 degrees now. So I can just feel very empowered in that fact. So I'm very happy that I made the decision, and I would do it again.
Yeah, indeed. And speaking of decisions, Audrianna, what would you say to women looking to make a career change? Because you spoke that very briefly, but other women looking to make a career change and interested in the nursing field, how would you inspire them, and what would you say?
I would definitely say go for it. No matter where you're at in your life, what you're going through. I feel like it's just something that you have to do. It's going to be tough, but if you don't go for it, you never will, if that makes sense. My peers and I, we were going through different things. We were all in different places in our lives. But I mean, I feel like that's what brings us together. We're all going through this tough thing together. But if you're thinking about it and you're passionate about it and you just want to help people, I say go for it. I had a baby in nursing school, but my peers and everyone was there to help me, and we got through it all together. So I would definitely say, if you're on the fence, go for it.
Did you make good patients? Because they say doctors and nurses don't make good patients because they know too much.
I maybe potentially could agree. I mean, I haven't been a patient since then, but I would say that for my kids, I feel like for me, like my son has a sniffle and I automatically think the worst. So yeah.
Dr. Gomez, what are some, and Audrianna shares a very interesting story of, a little bump in the road, but she went ahead and went through. But what are some of the barriers and pitfalls that you've seen nursing students encounter, both traditional BSN and ABSN programs? And what is your takeaway from that, and how do you keep them inspired? Because it sounds like Audrianna was right on point.
It is true that it is, as Dr. Cox said, it is a very rigorous program from the start. And I think as Dr. Cox had said, I taught her in her fundamentals class, which is usually the first course in a nursing program. And that first course is pretty difficult for students. And I think they come in kind of with a preconceived idea of, oh, well, I'm here to help people and I'll move on. But there's a lot of science involved in nursing. And there's a lot of pathophysiology, and you have to learn the interventions, and then you have to put them into action. So it's not only learning the content and being able to test on the content, but you also have to do that with real people from the very beginning. And there's a lot of variables with real people. So I think initially, just that idea of getting in there and having to talk to people that you just met about things that you never would talk to people about is part of the difficulty of starting out in nursing. But you soon learn to get over that and move along, and you realize that it takes a lot of study, a lot of time, and for the accelerated BSN students, that time is squished into even greater amount of time. So the amount of study and the rigor of the courses is something they have to learn quickly and keep up with throughout the program. Yeah. But it's kind of like having a baby. You forget about that when you're out. So our two graduates are right. Now they're happy they did it and it's over, and but they remember the good times. So
remember the good, indeed.
I'm proud to see all the nurses that have made changes and moved on. It's wonderful to see my previous student, Dr. Cox, here, and the students being so happy about their decision. So it's great.
I'm going to go off script here a little bit and talk about, and Dr. Cox, this might be your area, diversity, equity, and inclusion, but how can we do a better job of marketing the careers of nursing to men? Because traditionally, when people think of a nurse, they think of a female. But there are a lot of male nurses out there, nurses who are males. Okay, I don't want to say the wrong word because I've been corrected on that. So what would you say about that? How can you get over that hump, so to speak?
Yeah, nursing is still more of a female-dominated area, and certainly there's so many facets within nursing that whether you're a male or woman, or however you identify, you can practice in. I think certainly outreach and marketing is very important, and we have a lot of great people within the Marian community that reaches out to prospective students. We have kickoff events and just different events where if you are interested in nursing and you want to learn more about it, you certainly can have that opportunity. We have tours as well. So I think that, just getting that out there and maybe even looking at some of the more events that maybe males may be such as, the Indy 500 and things like that, maybe having some tables out there, but just having more community outreach will probably be a great opportunity. And our contacts certainly do reach out to those particular entities to try to get more males within the profession.
Yeah, and so heavily female dominated, yeah, it is. I think it is interesting because there are males who are interested in going into nursing. And speaking of which, with the shortage of nurses, the shortage of healthcare professionals in general, across the nation, and I'll ask each of you to weigh in on this, and we'll start with Kierra. What would your solution be to getting more people involved in nursing? How would you do it? How would you get more people involved, more people interested in this particular career?
I think that I could just start by saying that, nursing is not just bedside nursing. So there's a lot of stuff, a lot of different facets that anyone can fit into if they are thinking about a profession of nursing, or, just in general, like if you're trying to recruit more people into nursing, you could say, well, you could do something in the office, or you could do something in the community. There's just so many things that people can do. So nursing is just not like a one-trick pony. There's a lot of different options for people within nursing.
Okay, and Audrianna, we'll go to you next.
Okay, so a little bit like what Kierra said, just letting people know the different hats that nurses wear. So there are some people who go to work and they go in suits, more of the supply chain route, kind of figuring out what nurses need. And then there are also nurses at the bedside. So I think it's really important to kind of be transparent about what nursing looks like, and that it doesn't have to be just one thing. It can be a multitude of things. I think that would be really important to kind of showcase, because sometimes I think it's kind of, we have these notions of what nurses look like or what nurses do, but I think being transparent about that is really important.
Dr. Cox, how do we attract more people to the profession? How do we inspire more people to come into the profession?
Yeah, so there's over 190 different areas within nursing someone can be in, and that's phenomenal. So there is a place for everyone, and especially if you have a previous degree such as Kierra and Audrianna, it can make you so marketable. So just learning that, if you get bored in one area, there's certainly another area within nursing that you can journey into. I think also examining the different levels within nursing. So looking at the LPN and the ASN, and certainly the bachelor's as well. I think maybe one of the barriers may be time commitment for some people. So maybe doing a progression of a stair step may also help some people as well. And then just knowing that it's one of those areas where it's, recession proof. People are getting a little worried about certain industries because of the advance of technology. But within nursing, unfortunately and sadly, people are always going to be sick and need help. So it's one of those areas where, there is such a huge need. And it is a very lucrative and fulfilling field as well.
Indeed. And Dr. Gomez, what do you say? Where do you put the sign up? How do you get
Well, I think everyone has answered that question wonderfully. But one of the things is events like these. The public needs to know what the role of nursing is. And although I wouldn't wish the COVID experience on any community, that has done a great job of identifying what nurses do and how much nursing is needed in communities. So I think although it may have had some jobs that were eliminated or put on pause due to the COVID experience, nursing certainly wasn't one of those. It's a great time to be a nurse. There are jobs out there. The economy for the nurse is good. And events like these let the public know that what nursing does and who nurses are in their community.
Okay. And Dr. Cox, you touched on this very, very briefly, but if you don't mind, can you let our audience know the various levels of nursing, and what they entail? Because I think a lot of people may have that confused as well. And there's certain levels that certain people can attain in nursing, and, maybe certain levels are for some and other levels are for others. So can you give us a breakdown of that?
Yeah, so I kind of hinted on that as part of my journey. So I started as a certified nursing assistant. People know that more CNA or a tech, and so that's more of a certification, and it's more of a help to the nurse, which is certainly a need. And then you have your licensed practical nurse who can get licensed in that particular area. Their focus is more on medication administration and helping the nurse. And then you have your RN, the registered nurse. You can achieve your associates in nursing or your bachelor's in nursing. And certainly the bachelor's of nursing, there's more evidence within getting that degree in which it does help with identifying patients, decreasing patient mortality, and those nurses, because of their expanded scope, have a different level of critical thinking as well. And then certainly there's a huge need within our graduate levels, within the MSN, whether you are wanting to be an NP, a nurse practitioner, or pursue health administration. And then finally, the doctorate level, the terminal degree, to really look at research, look at implementation, and also being an educator.
Mm-hmm. Is there an age limit in terms of like starting a new career? Because like a lot of occupations, they want you 15 to 30, or not 15, I don't know, maybe they do, but anyway, 18 to 37 or 20 to 40 or what have you. Is it ever too late to become a nurse, even at any of those levels that you've just discussed, Dr. Cox?
I don't think so. We've had students who cashed in the 401k and they decided to come back and really become a nurse. Again, there's so many different areas of nursing. So you may, if you don't want to work on the floor, you may decide to work in case management or nurse recruitment or, social work or what have you. So I don't know if there's a cap on it. I think the biggest thing is having that passion.
Yeah, Dr. Gomez, you're nodding. There is no age limit, I guess. I mean,
there is no age limit. I think age is in the mind of the beholder. So we've had many students in their 50s, and I think we've even had a couple students in their 60s come back and become nurses. So I don't see an age limit for that.
That in and of itself is inspiring. So each of you has inspired just by sharing that particular information. Let me ask you this, and you all are, you're all veterans. To some a little bit more veteran than others, but you're all veterans now, established in your field. When you look back on a typical day in terms of what you're doing right now, or maybe what you did before, when you look back and on a typical day, what type of day or what type of activity, I guess, or what would have to happen for you to say, you know what, that's a good day. I am so glad I am a nurse. Is there you see what I'm getting at? Is there a particular scenario or situation that has you walking away saying, I'm so glad I'm in this field. I am so glad I'm here.
I can take that first. So whether working with patients or working in my role right now, one of the things I love, I worked at Ascension Health, which is a Catholic base, and Marion obviously is also a Catholic base, but the ability to work with people holistically, mind, body, and spirit. And so being able to connect my spiritual values, whether I'm with my students or with my patients, being able to connect with them in their most vulnerable times, and figure out how I can best help and serve them, I think is when I really say, I'm really happy to be in my field.
Okay. Audrianna, looking what makes you say this was a great day? It's a great day to be a nurse.
For me, so as of late, we have been very short-staffed. There have been times when we had to take 6+ patients, which is difficult. But for me, those days where I can spend more time with my patients, getting down to more than just, hey, you need to get up, you need to eat. Being able to spend more time with my patients and getting to know them, for me, that's a good day. Because I don't like having to go in and out really quickly and just say, here, these are the things I have to do and then go. So any day that I get to spend more time with my patient, kind of figuring out what can I do to help them get better and feel better is just is a good day for me.
It's a good day. Kierra?
Well, I'm still pretty new. I just started like a month ago, but I could say that a good day for me would just being able to go into a patient's room and explain something to them and them understand why it makes sense for them and, their plan. And then just us kind of having an understanding. I just feel like that's a good day.
Mm-hmm. And Dr. Gomez? You probably had several good days.
Yeah, so there, it's hard to say what makes a good day, but it truly is that connection with the patient that makes that such a good day. I always tell students that always remember that you might see a lot of patients every day, but you might be the only nurse that patient meets in a year. So you have to represent nursing in a way that shows them what it is to be a nurse. And I think when you do that, and you do that with each encounter with the patient, that's a really good day.
So Dr. Gomez says, and any of you can answer this as well. I'm sure you'd like to share because we are inspiring here, but has a patient or anyone that you've come across, be it a student or whatever, is there one thing someone said to you that had made you glad you're a nurse as well? Something you'll never forget? Patient, student, family, anybody in your role?
For me, it's not just the words they say. Patients always say thank you, but you have the feeling that they really mean that, and that's what makes the difference to me.
Okay. Dr. Cox, anything that's been said to you in the course of your career that you'll never forget?
I agree with Dr. Gomez, and I think it's more of I'm really there to do a work. It's not necessarily, whether they say thank you or not. It's just the ability to serve. So that in and of itself is all that I need.
Yeah, indeed. So this seminar, of course, is sponsored by the Marian University Accelerated Nursing Program. And what can you share with our listeners about that program? I think you touched on it a little earlier, that it is accelerated and that it can be rigorous, but it's very rewarding. Can you fill in the blanks for us there, and what accelerated means, and what folks should know, male or female, who are heading into this area or thinking about it?
Dr. Gomez, were you going to take it?
You can both answer.
So Marian University has a phenomenal partnership with Ascension Health. Ascension Health is one of the 2 major Catholic organizations across the nation. And so students who have a bachelor's degree can obtain in something else, can obtain a bachelor's degree in nursing. And so they complete this over the course of 16 months at Ascension Health, and primarily within our 86th Street campus, Carmore Fishers. And one of the hopes is that the student will consider becoming an Ascension Health nurse upon graduation. We feel as though their values is very comparable to our Franciscan values in terms of service and transforming lives. So the rigorous piece is just the completion of didactic and clinical hours over the course of 16 months. Our curriculum is really innovative, and we are always keeping up with the times to make sure that our nurses are practice ready and able to critically think for our diverse and acute patient population.
Indeed. Dr. Gomez?
Dr. Cox has that all down pat. She really works with the program and has been with the program for some time now. It is a rigorous program that's very compact. The students can attest to that, I'm sure. But I think that's what attracts people to the program, that they can get out in 16 months after completing all the prerequisites and things prior to that. But it's hard work going through, but as you can see, the output is wonderful. We have wonderful nurses that do great things.
Yeah. So words of wisdom, Kierra and Audrianna, you're wise now. So what wisdom can you share with your peers?
So for me, I'd like to say that you can do anything for 16 months. It's going to be tough. I encourage everyone to lean on their support systems, lean on the people you're going through it with, but you can do anything for 16 months. And then when you're done, you won't realize how fast it went. So yeah.
Yeah, 16 months. It sounds like a long time, but then again, when you consider what you're getting at the end, it's not necessarily that long. It's just more. And when we say accelerated, are we talking about classes 5 days a week, classes on the week? I mean, what does accelerated entail?
So for us, the first semester is when you have your labs and clinicals more often, but then most of the coursework is online. You take you have proctored exams. I'm not sure what that looks like for COVID because COVID started in the middle of my last semester. And so I'm not sure what that looks like now, but in the beginning we had, for the first semester, you have 3 days a week that you're in person aside from exams, and that includes clinicals. And then after that, you really just have clinicals and exams in person. Potentially, the last semester we had various like presentations that were in person. But like I said, I can't really speak on what that looks like now. But really the biggest time commitment is committing yourself to like what Dr. Cox told me in the very beginning was going to class. So going home and making sure you schedule your time. And that was the most important thing.
So a lot of guidance along the way. I mean, did you have, so you had some advice right before you started, right? Yeah, that's great. That's great. So Kierra, words of wisdom. Were you ready for the 16 months, or you thought you were ready, and then when you got into it, you stayed after it?
I thought I was ready. You know, you can really never be completely ready because nursing school is just completely different from any other type of education that you would be getting. But nonetheless, I did come out successful. So I would just say that you just have to really prioritize this nursing school because it is different with the accelerated program being mostly online. You have to prioritize, you know, I need to do X, Y, Z today. I need to wake up at this time so I can get this done before I have clinicals tomorrow. So it was really just kind of making sure that I was doing those things so that I could, you know, come out at the end of the week and not be super stressed.
And this accelerated program is for the RN degree, correct? RN certificate.
Yeah.
RN. Okay.
So they'll be achieving a BSN in nursing, a bachelor's of science in nursing.
Oh, okay. So approximately how many nurses per year are graduating out of this program?
So we graduate 3 times a year, and we bring in anywhere between 50 and 75 students.
Wow.
Each time. We've had over 1,000 graduates over the course of our program in the accelerated online. Now Marion has had a nursing program since the 1970s, so it skyrockets even from there. But yeah, and so our students will complete 705 clinical hours over the course of the 16 months. And so they'll have hands-on abilities, not only within our lab, but within Ascension Health as well. And they'll also do clinicals within Ascension Health. The content is online, the didactic piece, but their actual practical piece, because nursing isn't applied science, it is truly in person. Not only within our accelerated site here by the pyramids, but also at St. Vincent Health. And there are times where we'll go to main campus and complete simulations as well. So yeah.
Yeah, so the graduation rate we got. What about the acceptance rate for people who are wanting to apply? What's your acceptance rate?
So pretty much we have an up to 80 students each semester at the Indianapolis campus.
Wow.
And we have clinical spots up to 64 students 3 times a year at the Nashville campus. And we just started in Oklahoma City, our first cohort of 3 students, but plan on accepting up to 24 at that campus 3 times a year. So then we also have our so we accept students and students occasionally have been waitlisted, but not usually, but they have to meet the prerequisites.
Well, you'd want them to, wouldn't
you? Right?
You'd want them to be based on the field. I mean, this is life or death. So this is very elite work.
So they have to meet the criteria to get into the program. And I think that's where we may lose some students, that they don't meet that criteria. They have to keep a good GPA. They have to complete a lot of sciences, basic sciences, before they even get into the program.
But your success stories are phenomenal, because every program is going to have that, right? Every program.
Right. Absolutely.
Every program is going to have that. But your success story is worth telling, because it's absolutely phenomenal. I mean, look at Kierra and Audrianna. I mean, my goodness. And you and Dr. Cox, of course. But this is just phenomenal. My mind is blown by how much information you all have shared with just that I've learned in just this short amount of time. So you say 3 classes a year? You take on 3 nursing classes a year?
In the accelerated program on campus, we have 2
accelerated program, yes.
Traditional BSN students.
And very quickly, who best fits the profile in order to go into the accelerated program? Because the accelerated program is obviously designed for who?
It's designed for someone with a previous baccalaureate degree, so they have to have a degree in something other than nursing. And then perseverance and the will to get it done, I think, is the next criteria for them to really work at moving forward.
Yeah, it's not just to get through nursing school in a hurry, though. The accelerated program is not that. I guess I want to make sure that we make that clear, that it's not just to rush you through to get your RN, your BS or BA. It's not that.
No, you work very hard throughout that program. It's very difficult to maintain other employment in the program. It's not life as usual and then add nursing school. It becomes nursing school. So, but it's only 16 months. So as we've heard, you can do anything for 16 months, I guess.
Oh, well, yeah, I you know what you've all been very clear examples of is how special you are. And we want more special people just like you to be able to take advantage and to be out there serving our communities in whatever capacity that they could possibly serve in. And so if someone wants to find out more about the university, the accelerated program, the university's accelerated nursing program, where should they go and what should they do? Is there a website or?
Yeah, so I think the easiest way is to go to the Marian.edu website, and it's Marian with the A-N, not O-N. And then from there, you can look at the different tracks and see what's best for you. And usually there'll be the admissions associates who can kind of text in once you go to that website, and they'll get your information and go from there.
When does the next class start? The next accelerated class start?
May 10th.
So what does that mean? Like if you don't have your application in by May, but you have until May 10th. No.
So those, to Dr. Gomez's point, those students have already completed their prereqs and they've been admitted by our nursing program. But certainly, if you are interested, you can again reach out to our admissions department and we can get you on that pathway to begin doing that. Yes. But we do have start dates January, May, and August in the online accelerated.
Yeah.
They can also search the Marian ABSN on Google, and it can get you there as well if you're interested in the online accelerated program.
Indeed. So any closing thoughts? I'm getting the wrap here. So anything any of you want to close out with and make sure that we didn't miss, because now's your opportunity. I really do thank you all. You all were great. So anybody have any closing thoughts? Kierra, Audrianna?
I mean, I just wanted to say that if you're passionate about nursing, you're passionate about helping people, go for it. If it's not for you, it's not for you, but 16 months is 16 months. As you're going through it, it seems like a lot, but when you're done, you're going to realize that it wasn't that, you've changed so much throughout this 16 months, but you've gained so much as well.
Okay. Kierra?
Absolutely. Same as Audrianna. Even though it is nursing school, and nursing school can kind of seem daunting, with that big looming title, anyone can do it. You've already got a previous bachelor's degree. You can probably go ahead and get your nursing if you're thinking about that as well. So,
okay. Dr. Gomez, anything? I know you learn something new every day because you're a lifelong learner, so I know you do.
Thank you all. I've learned a lot today listening to our students and how happy they are to be finished. I thank you for having us. It is a great time to be a nurse. Indeed.
And Dr. Cox, any closing thoughts?
Again, if you're interested, you can Google Marian ABSN, Marian. You can also go to the Marian.edu website. But nursing is just such a great field to be in. As I continue to work with Dr. Gomez, it's always so surreal because she taught me, and here I am. So it's just one of those very fulfilling careers. So I hope that you all seek interest in that, and I hope to see you all.
We do indeed. Kierra, Audrianna, Dr. Gomez, Dr. Cox, thank you all so very much. Thank you to the Marian University Accelerated Nursing Program for sponsoring this seminar. And thank you, David, our director, who he pulled us out of the fire. We had a little kinks here and there, but he pulled us straight out, and we're good. So anyway, much continued success to each and every one of you. And hopefully we'll be talking again soon. Thank you all so very much.
Thank you for having me.
Thank you. Bye.